Dear listeners and Facebook viewers, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of the Health Break, inshallah. Today with us, we have, and as promised from the last or the previous episode, we have Dr. Wafa Samen, and we will be discussing infertility, IVF, inshallah. Dr. Wafa Samen has had more than 25 years of experience as an obstetrician and gynecologist, and undertook her master in reproductive medicine in the University of New South Wales in 2010, so she could also help and support patients with infertility concerns. Dr. Samen is fluent in both Turkish and Arabic languages to help our community on a higher scale. She currently sees patients throughout Auburn and St. George Prophet Hospital, and she's also a specialist with the IVF Australia, largest network of fertility clinics since 2010, and she sees these patients from or through Westmead and Liverpool, which she will be discussing this a bit later with us, inshallah. As a fertility specialist with IVF Australia, Dr. Samen can offer her patients world-class fertility treatment for addressing infertility, access to the latest reproductive technology and techniques. Many doctors refer their patients to Dr. Samen for her compassionate care and outstanding surgical infertility results. She also consults closely with His Eminence Dr. Ibrahim Abu Muhammad, the Mufti of Australia, to ensure that IVF and fertility treatments she offers fit within the guidelines of Islamic faith. We welcome Dr. Samen with us here to the Quran Kareem Radio of Australia, and for giving us her time again and again, inshallah. Assalamu alaikum, Dr. Wafa.
Alaikum assalam wa rahmatullahi wa barakatuh.
How are you this morning?
Alhamdulillah,
Alhamdulillah, alhamdulillah. So good to have you back with us. And as we promised our listeners that we will talk about infertility in the last episode, inshallah. So we're going to go to the first question that we have from our viewers. First of all, we want you to clarify for us the meaning of infertility, and can one ever have a child?
Infertility means inability to conceive within 6 months of trying.
Right. So there's is there a chance for or the chances of one having a child? Can you explain that, please?
Yeah. Now, infertility issues is very common nowadays.
Right.
1 in 6 Australian couples of reproductive age experience difficulties conceiving a child. 1 in 6.
Right.
The chance to conceive naturally in 1 month is 20%. 20%, 1 in 5. That's naturally in 1 month, and that is for a woman who is younger than 35 years old.
Yeah.
With advanced reproductive technology, the chance is higher. Now, about 60% chance of success in 1 month for a woman who is younger than 35 years old.
Okay.
The single most important factors affecting the chance of conception is woman's age. So
Right.
Younger than 35, the chance is better, and this all related to the quality of eggs, which drops dramatically after age of 35.
Right. So basically, you've covered this. Is anything you want to add is on how common is it for infertility?
Yeah, it is common, and the reason, what are the causes of infertility?
Mm-hmm.
40% related to women's factors, and 40% male factors, and 20% unexplained. Now, women's factors could be anovulation, and that's the most common one. And how do we know that? If woman having regular periods, which means she is ovulating, always irregular periods means there is a problem, which means she is not ovulating. And the most common cause of anovulation is obesity, whether it is related to polycystic ovary or just obesity itself, or any other endocrinological problem like thyroid problem.
Right.
Then we have tubal factors. That's another reason why women can't conceive, or any problem inside the uterus. Male factors, sperms, which is again a sperm concentration number, and motility, and normal looking sperms. And as I mentioned, 20% of factors we don't know is because unexplained pregnancy.
Right.
And then how we investigate and when we investigate.
Right.
Now, regardless of woman's age, trying for 6 months without achievement of a pregnancy requires seeking medical advice. And whether the patient attends her GP, general practitioner, to start with some investigations, and then send them to us as infertility specialists. So first thing, what we do, the history. We ask the patient, how long has she been trying to conceive?
Right.
If she's been trying for years, then the chance is lower. Then whether she had a child before, or whether he fathered any child before, and whether she's fit medical, if there's any medical problem. Then we run some investigations, including blood tests and checking fallopian tubes, and for him to do sperm tests. Now, blood tests, I usually advise a woman who wants to get pregnant to go and see her general practitioner to do what we call it antenatal screening test. These are checking hormones and checking her infectious status. Infectious status means if she is not immune against rubella, which is German measles, or varicella zoster, which is to give you chickenpox, she needs to have vaccine before trying. Now, because rubella, which is German measles, causes, if woman catches that virus during a pregnancy, especially first 12 weeks of pregnancy, and then the baby could develop congenital abnormalities. So that's why I strongly advise women to go to GP, get this blood test done, and if she's not immune, then she needs to take the vaccine. The vaccine should be given during period. When we are sure definitely she is not pregnant, then she needs to take the vaccine and wait 1 month before trying. Then we need to check her iron level, we need to check her vitamin D, and check thyroid. Now again, studies showed if the thyroid is underacting, then the baby could develop problems with give you low IQ. And so that's why, and even affects the results, affects the chance of pregnancy, and could cause miscarriage. So that's why these important things, these factors, blood test needs to be done before trying.
Now, these studies are done on the female. So when someone is not conceiving and not having the chance to get pregnant, so you do the investigation on both male and female, on the mother and the father?
Yeah. So I prefer to do both together. So for women, as I said, we have blood tests. Blood tests, we have two groups. One group is infectious, which is checking rubella, hepatitis, all these. Another group is hormones, to check her thyroid, check other hormones, prolactin, which is milk hormone. Yeah. And then we need to make sure whether she has normal patent fallopian tubes. Right. For women to achieve a pregnancy, two factors are important, which is ovulation and the uterus and the fallopian tubes. How we check that? Either through ultrasound scan or through an X-ray. I prefer ultrasound scan, what we call it hycosi. which is less painful. Normal hypoxia doesn't come on Medicare, but from January last year, government is paying $500 for any infertility investigation, and there is link. Patients pay this cost, then she can claim it online.
Alhamdulillah. Alhamdulillah.
So that is her side. For him, again, we need to do infectious screen, and we need to check his sperm.
Right.
Sperm tests, I always advise men to do sperm tests where the area has on-site collection area.
Mhm.
Because if you collect at home and drive the sample to lab to be tested, then delay or weather, hot, cold, that affects the quality of a
Right.
sperm analysis. So that's why I prefer to be done on site. See, with IVF Australia, we have a few sites all around Sydney, and as I said, it doesn't come on Medicare, but government is helping with the cost of infertility. So
Right.
he can pay and then claim it online.
Oh, that's right. Okay, so having the investigation done on site is what you recommend for a male. Now, Dr. Wafa, how long should one try to conceive before they see a doctor? You said 6 months. But like, is there leniency? Like, once you know, like, for example, it's not tubercle, it is hormonal, or it is something to do with like with vitamins or anything like that. Like, do you take straight away the steps into treating, or do you treat the actual problem before you start your IVF treatments?
Oh, that's a good question. See, if it is tubal factors, if she does have blocked tubes, whether unilateral or bilateral, which means one side or both sides,
Right.
quite often asymptomatic. She doesn't have symptoms.
Okay.
If it is male factors, again, quite often is asymptomatic. He doesn't know he does have abnormal sperm, whether it's count, whether it's concentration, motility. So if she's trying for 6 months, now I prefer to investigate.
Right.
Once I investigate, once I make sure the tubes are patent and she is ovulating and she has regular sexual intercourse, especially ovulation time, in this case, I'll wait.
Right.
Again, the important thing which I would like to mention, checking the tubes, just simply flushing the tubes.
Right.
Patients can get pregnant, 60% of them within 2 months.
Okay.
Because fallopian tubes opening is very narrow. So you could get blocked with mucus plug, blood clots. Just simply flushing the tubes.
Right.
If she is ovulating, if her husband's sperms are normal, then 30% of them do get pregnant within 2 months. So that's why I give them wait. Especially if she's young, I'll wait up to a year. After knowing that all the factors are normal. Say if she is unovulated, if she does have unovulatory cycle, irregular periods, even if she waits years, she's not going to achieve a pregnancy unless I treat her and get her to ovulate.
Right. Dr. Wafa, is there a wait between treatments? Say, like, you started a treatment and then it didn't work. So do you give them a break for a while? And how many times can you repeat it before you find a result and you say to them it is not la samah Allah, like it's not working?
Okay. Say for example, if she's overweight, I'll advise her to lose weight because again, weight has big implication on the success rate.
Right.
Now, she lost weight, some weight, then I gave her some tablets to help her to induce ovulation. She's ovulating, having regular periods.
Right.
I give them 6 months. Why? Because that doesn't mean if she ovulates this month, she's going to get pregnant. Okay? So 50% of people when they're ovulating, they're not achieving pregnancy. We need to wait up to 6 months. After 6 months, if pregnancy is not happening, if she's young, again, I encourage her to wait a bit longer. Then if it doesn't work, then we go for IVF.
Okay. But the treatments between IVF, Dr. Wafa, like say you started your treatment for IVF, in August. So what do you, and didn't work. What is what is the time that you give them until to try again?
Okay. Now, say, I'll just give you, because that's IVF treatment is really complex issues. It depends, like, on the, first of all, on the reason why she can't get pregnant.
All right.
Say, for example, if the sperms are not good,
Right.
and it's well factor and nothing wrong with her,
Right.
um, then I've done IVF, say, one cycle.
Mm-hmm.
For example, I collected, say, 8 eggs, and
Mm-hmm.
I don't expect all eggs get fertilized. If I collect 8 eggs, if 4 of them fertilize, which means we are doing well, 50%,
Yeah.
and then let them to grow till day 5.
Yeah.
Say from those 4 embryos, say 3 of them reach day 5. This
Right.
is the day where we transfer the embryo back inside the uterus.
Mm-hmm.
Say I transferred one embryo and was unsuccessful. No results.
Right.
When there is no result, and if I have still frozen embryos,
Mm-hmm.
I'll try next month to transfer that frozen embryo.
Okay.
But if say I've done the IVF and was only ended up having just one embryo suitable to be transferred, and transferred that suitable embryo didn't work, in this case I give them 1 month uh, before starting. Why? We need to wait for the body, for the hormones and body go back to normal. Then we try. This is where the study showed we get better results. Then,
Okay.
if you ask me how many times I can try, there is
Yeah.
no limit. As far as she's happy to try, yeah.
Okay. Fair enough. And now you spoke about the age factors for a female. Like, does it matter for a male as well? Like his age?
Okay, for male, it does matter if he is older than 50.
Okay.
And again, lately studies showed, uh, there are some studies showed that their chance of autism
Right.
for if males age more than 50.
Okay.
Yeah.
Okay. Thank you, doctor. What are the we spoke about the treatments. Now, how is IVF looking in regards to advancing in the future? Is there like a future studies for in research for advancing it in any way?
Yeah. See, IVF is the most advanced area in medicine.
Hmm.
Lots of research. As I said, it's getting really common, those infertility issues.
Right.
So in our group, IVF Australia, probably you're aware that's one of the largest group in Australia and worldwide as well. Um, we constantly having research. We have like 5 professors in our group, constantly researching and attached to St. George Hospital, Royal Women's Hospital. And so some of the technologies which we have um, at IVF Australia, for example, a microscope which we use to magnify abnormal sperm. See, the normal one, which is available in other like public hospital or low-cost clinics, magnifies the sperm to 700 times, but the one which we have, we call high magnification, which magnifies the sperm to 7,400, which means we can choose the best of the worst.
Right.
And that helps to achieve, again, the media which we use and the way we freeze embryos. Now, our frozen embryos, about 98% of frozen embryos survive thawing process. So that's all, again, related in advances of the media and the way they freeze embryos.
So you, in other word, you're always on top of it, like in advancing it and flowing along with the advance of IVF. Thank
Correct.
you so much, Dr. Wafa. We mentioned in your bio that you have closely worked with Dr. Ibrahim Abu Muhammad and to seek religious views in regards to these treatments. Is there any boundaries in regards to our religion? Have you learned anything that that we need to or we cannot have in regards to religious measure?
Correct. Now and then I come across questions whether is it halal allowed in our religion to do IVF, and I checked with Dr. Ibrahim Abu Muhammad even before starting IVF, and he mentioned that IVF is allowed as far as marriage relationships is valid and ongoing, but like divorce time or death, then no, we can't.
Of course, yeah.
Yeah, and the other things which is not allowed in our religious, which is donor egg. Even one time I asked Dr. Ibrahim Muhammad why we can't have donor egg if the child in the future knows who is biological mother. He said no, we can't. It's definitely not allowed. So that's why I don't do donors at all, donor egg or donor sperm, and I don't do surrogacy as well. Surrogacy means when the woman cannot hold the baby, then she hires the uterus to hold the baby for her. It's not allowed in our religious. So it's allowed as far as the couple's married, then that is okay.
How about freezing freezing the egg? For a female,
It is allowed.
allowed?
Yeah, it is allowed. See, with the freezing, say there is a consent form which she and her husband signed the consent form.
Right.
States that if one of them died, what's happened to those frozen embryos? In our religions, the frozen embryos should be discarded.
After death, it should be discarded.
Yeah, say after death, divorce. So if that marriage relationship is still not ongoing, the storage should be frozen embryos should be discarded.
Yeah.
And I am really strictly follow all these measures. I had one patient yesterday. They are Muslim, and he said he asked his sheikh, it is allowed to have donor eggs. I said, I'm sorry, I can't do it. He said, but doctor, I asked the sheikh. I said, no, I am following Mufti's advice. Not allowed. I can't do it. I'm sorry.
Jazakumullah khair. Jazakumullah khair. May Allah subhanahu wa ta'ala reward you, Dr. Wafa, and inshallah enlightens you with more and more inshallah information to help our community and help our people in society, inshallah. And Dr. Wafa, can you please explain the places that you operate out of? Like I know I mentioned Liverpool and Westmead for IVF, and you have you have your consultations throughout St. George Private and Auburn. Can you explain a little bit about your services there?
Yeah. Now
in the cost. In the cost.
Yeah. Now with IVF, lots of people again are not aware that we have low-cost clinic at Liverpool, which is part of IVF Australia. Mm-hmm. So what does it mean, part of IVF Australia? So we follow same protocol. See, we 5 doctors from premium clinic work with IVF Australia, which I do mostly with me. Occasionally go to Alexandria if the patient lives that area. This is a premium clinic where the patient pay $5,500 out of pocket money. That is the premium clinic where the whole cycle and egg collections done at Westmead. And then we have low-cost clinic, which I work there as well. That is Liverpool. Low-cost clinic means the patient pays, if she does have healthcare cards, $700 to cover all the cost of IVF, consultation, medications, and the cycle, egg collection, and embryo transfer. And if that doesn't work for subsequent cycle in one calendar year, she's pay only $400. If she doesn't have healthcare card, then just Medicare, she pays $1,500 out of pocket money for first cycle and $700 for subsequent cycles in one calendar year. So there isn't such price such good low price.
Mhm.
And this clinic, which is, I really encourage my patient to go there, because it is all the protocols of premium clinic, staff from premium clinic, no waiting time, no registrars, no trainees. How good is that?
Very good, excellent, mashallah. Like, we are so blessed to be in an environment or a society as such, and we're so blessed to have you helping our community as such, and advising them. Alhamdulillah, we have the great leaders and great opportunities from government as well. So it's so wonderful to have you. I know this interview with you, Dr. Wafa, is just to give like a brief information about infertility. I know it's a huge field, and you would like to speak more about it, and of course, we want to cover the positives and the negatives and the outcomes. We would like to have you, if you don't mind, on another program to feel free to explain further. What do you think, inshallah?
More than happy to do that. More than happy.
Jazakumullah khair.
And
Dr.
thank you
Wafa,
very much for inviting me.
before we close this session, do you have anything to add to this interview?
I just would like to tell my sisters and brothers, infertility is common issue. And it says there's nothing to get shame about it. And if you have a problem, just seek advice. And we are here to help.
Thank you so much, and we're so blessed to have you, behind us all. Jazakumullah khair for your time. May Allah subhanahu wa ta'ala reward you. I would like to thank you on behalf of the Quran Kareem radio team for being with us here today, inshallah. And may Allah subhanahu wa ta'ala, have it in your highest scale of good deeds, inshallah. Jazakumullah khair. Dear listeners and viewers, you can send your questions and suggestions or feedback to the email and email us, on the healthbreak@qkradio.com.au, and we will meet again, inshallah, with the will of Allah subhanahu wa ta'ala, with another episode of the Health Break. Inshallah, we leave you with Allah's blessing. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.